Junior doctors would like to thank the support of Bath Labour and of all the members of the public in Bath who have come along to support junior doctors, who've brought food and gifts, who've come along and said, passed on kind messages, and have showed us their public support by standing here on the picket line and fighting for what we believe in, which is a safer, fairer and equitable, sustainable NHS. We are participating in a full walkout today, which is unprecedented in the NHS's history, because the government have not listened to us. We have unfortunately had to strike 4 times previously, and Jeremy Hunt has remained completely steadfast in his decision to impose a contract which we don't believe will achieve anything positive for patients. He's using the rhetoric that this is for a safe 7-day NHS, and he misleads the public by suggesting that it will improve the so-called weekend effect and will reduce mortality. In reality, we know that that's not the case at all. We don't have a weekend effect here in Bath. We provide a very good 7-day service here in terms of emergency care, and that is pretty much wholly supplied and provided by junior doctors. So junior doctors are slightly bewildered as to why the government have chosen us as the first group they are targeting in this so-called manifesto pledge. They say that 90% of the contract has been agreed, and this is about one remaining issue, which is Saturday pay. That is simply not the case. That is a lie. It's simply spin. It's simply there to try and turn the public against us, to try and make this a so-called pay dispute, when actually, yes, there are some issues about pay that we're concerned about. We don't understand why we need pay protection for 3 years, because that implies that actually we will then face a pay cut after. We know that many doctors will face a pay cut. But what this is about is an unplanned, uncosted, botched together contract which won't work from August this year. We are concerned about recruitment and retention of junior doctors in the NHS who, quite frankly, are fed up of being denigrated and would rather just move abroad to a fairer system where they're not demoralised, where they have a better work-life balance and they're able to look after their patients because of that better. So the government just need to listen. They need to listen to 50,000 junior doctors. They were hoping that during this full walkout there would be a crisis of confidence in doctors and we would fall apart, the message would fall apart, and it would somehow play out in their favour. But actually there's reports that 80% of junior doctors have participated in this, which is far, far better than even we had hoped for, and that is a big slap in the face for the government, quite frankly. They just need to listen. The BMA and junior doctors have made it very clear. The one thing we ask for is to drop imposition of this contract. It's not about money. We're not asking for more this, more that. We are saying you need to drop this. We don't need a new contract in August 2016. There's not some terrible crisis in patient safety which means that this is necessary. You need to step back, say this isn't working. Listen to Heidi Alexander, who incidentally is a fantastic shadow health secretary and speaks an awful lot of sense. Let's listen to our concerns and listen to junior doctors, not just the BMA, grassroots doctors, 54,000 of us who are saying this won't work, it's unfair on women, it discriminates openly against women, and will cause a rota crisis. It's not cost neutral. The hospital here in Bath know that it's not cost neutral, and it's going to cost hundreds of thousands of pounds to implement, and will leave big gaps in rotas, which will mean that they'll have to employ more trust doctors. Unfortunately, they just don't exist. And trust doctors are doctors who are not in training grades, training posts. You can hear the support all around us, lots of honking of horns. So we would say, get back to the table. We need this to be a serious discussion about how to make the NHS better at the moment. And why not make the 5-day elective NHS with 2-day emergency NHS over the weekend better, rather than aiming for, quite frankly, the unachievable at the moment. in times of austerity, there is no other free at the point of access 7-day healthcare system in the world. Why on earth is Jeremy Hunt and David Cameron trying to achieve that? It's not possible. They just need to listen. The public are listening to us. We're saying, message is clear. We care about patients. We're not thinking about our wallets. If we cared about money that much, we would be going forth with their privatisation agenda, which is quite clear. So this is about the NHS, the future of patients, the future of the profession.